When you think about needle sticks, you always kind of think, oh, it's not going to happen to me, but you're never prepared for the things that come out of nowhere. It was a couple years ago. I was actually pregnant with my second child. I was just walking across the room and all of a sudden I had a really sharp pain in the bottom of my right foot. A suture needle had gone all the way through the bottom of my shoe and into my foot. The patient in the room at the time actually was positive for HIV and hepatitis C. Not only was I afraid for myself and the possibility of what I could contract, but I was also thinking about my unborn child. I thought about my other child and my family at home and telling them. I thought about how it was going to impact my personal life and the things that I had to be careful with. I was just afraid. They set me up on a schedule, told me I would have to be tested for at least 6 months. The hardest part of the whole process was just not knowing. It's not just one test and it's over. It's waiting. It's being tested again and again and again. And you never know, just walking around in your everyday life, if something is inside of you making you sick. It was all very complicated and overwhelming. Thankfully, after all of the 6 months worth of testing and all of the negative results, they were telling me I didn't have the disease. There wasn't a chance I could pass it to my child. However, it's not gone. It's not ever gone. I don't ever not think about it. It's still there in the back of my mind as something that I went through. And quite honestly, not everyone is that lucky. You know, it could have turned out very differently for me and my child. Needle stick safety is important because it's not something that someone thought up one time as just another rule to follow. When you go through something like this, it really brings it home to you about why you do it, why it's so important, and the effect it can have not just on you, but on other people around you. We have these things here in place for a reason, because maybe someone just like me, has gone through this, and we are trying to protect you and trying to protect those around you. So even though it may be more difficult, you make a difference.
In this video, you will meet the staff in the Employee Health Department. We are here to help you. We want to answer your questions and make sure you have a pleasant experience. We want to inform you about needle stick prevention, the types of fluid that constitute an exposure, and our exposure rates here at UMC. We also want to educate you on what is and what is not considered an exposure and how to avoid them. Note the potentially infectious material that constitutes an exposure on the left-hand side of your slide. These fluids are known to carry the hepatitis B, C, and HIV virus. These fluids consist of semen, breast milk, vaginal fluid, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, amniotic fluid, and blood. The non-infected material that does not constitute an exposure, if there is no blood present, is listed on the right side. Those fluids consist of feces, urine, vomit, nasal secretions, saliva, sputum, except during a traumatic procedure such as dental work or a traumatic injury or intubation, sweat or perspiration, and tears. Again, this is if there is no blood present in the material. Let's talk about a few things that do not constitute an exposure. A splash with non-infectious fluids or potentially infectious fluids to intact skin is not an exposure. A splash to non-intact skin with non-infected materials is not an exposure. A puncture with a clean needle to skin is also not an exposure. So what is a true exposure? There must be blood-to-blood contact, which is contact with blood or potentially infectious material to non-intact skin. Or there must be a puncture in the skin by a contaminated sharp with blood or potentially infectious material. Finally, there would be a mucous membrane exposure, which would be a splash to the eyes, nose, and mouth with blood or potentially infectious material. Nurses are the largest group affected by needle sticks. This is due to the nature of their jobs and the fact that they are usually the largest segment of the healthcare workforce. Physicians, laboratory staff, respiratory therapy, and EVS staff are also some of the most common populations for needle sticks. WIN is an acronym we use to educate employees on what to do following an exposure. W stands for wash the area thoroughly for needle stick, or use the eye wash station for 15 minutes if exposure is to your eyes. I is for identify the name and medical record number and date of birth of the source patient. N stands for notify employee health nurse or the house supervisor. If it is after hours and employee health is closed, the house supervisor will take care of the exposure, but you must come by employee health before you go home in the morning so we can make sure everything is completed. So let's talk about what you do following an exposure. You would only go to the emergency center if your injury is severe. Lab tests should be done as soon as possible after the exposure. Notify employee health following an exposure during regular working hours. Contact the house supervisor after hours and on weekends. Post-exposure prophylaxis medications should be started within 4 to 6 hours of exposure. Complete the employee incident report as soon after the exposure as possible. Blood and bloodborne fluids expose employees to a number of bloodborne pathogens. The 3 pathogens that pose the most serious risks are HIV, hepatitis B, and hepatitis C. HIV is a virus that attacks the body's immune system and lowers the body's resistance to infection. The HIV virus causes acquired immunodeficiency syndrome, more commonly known as AIDS, for which there is currently no cure. There are new medications that can be taken within a few hours after exposure and may prevent the virus from becoming HIV. Hepatitis B is also a virus that can cause acute or chronic liver disease. Approximately 1/3 to 1/2 of the people with acute hepatitis B develop symptoms, and 5 to 10% develop chronic infection. Vaccinated healthcare workers rarely convert to hepatitis B following an exposure. Hepatitis C is a virus that also affects the liver and is currently the most common chronic bloodborne infection in the United States. Symptoms are usually absent to mild. Hepatitis C becomes a chronic infection, and there is no treatment during the early stages. There are new meds for chronic hepatitis C, but cannot be started until the disease has been present for at least 6 months. Let's talk about the risk of conversion. The chance of conversion to HIV from a needle stick is 0.3%. which means there's a 99.7% chance that no conversion will occur. The chance of conversion to HIV from a mucous membrane exposure is 0.1%, or again, that means you have a 99.9% chance that there will be no conversion. Hepatitis C is the most common infection for healthcare workers since there is currently no vaccination available. We had a total of 89 needle sticks in 2016 here at UMC, and out of those, 30 were from nursing. We must get them down even more. From 2015 to 2016, we had a 13% decrease in needle sticks. This includes all needle sticks, employees, students, residents, and attendings, but the decrease was only for UMC employees. At UMC, as well as nationwide, the most common causes of needle sticks are hypodermic needles used to give injections, suture needles used to close incisions or traumatic injuries, blood collection needles used to draw blood, and butterfly and angiocaths, which are used for IV delivery. The cost of exposures are very high, both emotionally and financially. They can cost from $500 to $5,000 depending on treatment provided, including baseline and follow-up testing. Because of the testing, it can cost the employee productivity, loss of income, and possible loss of career if the labs are positive. The emotional and societal costs can be much greater if the employee develops hepatitis B, C, or HIV. Now let's talk about some unsafe work practices. Recapping of needles and improper activation of safety devices has been considered an unsafe practice for many years, but continues to occur. Transferring blood between containers and failure to dispose of sharps devices immediately and correctly are the most common unsafe work practices. As you might expect, prevention is the key. Prevention is comprised of avoiding sharps injuries, planning ahead when you're using sharps, always report a blood and body fluid exposure as soon as possible, and you should always participate in exposure prevention. I think this quote makes a lot of sense. I was infected courtesy of a lapse in concentration. Other forms of prevention are to avoid the use of needles when there are needleless devices available. Also, plan in advance for safe handling and disposal of sharps devices. Remember, prevention is the key. You should always report workplace hazards, participate in sharp safety training, and remember, as a preceptor, always educate your new employees. Remember, sharp safety begins with you.